do you have to lose? Take it. I really think they should take it. Hydroxychloroquine. Try it. Hydroxychloroquine, which I think, as you know, it's a great malaria drug. It's worked unbelievably.
What do you have to lose? President Trump asked. Well, today a new Veterans Health Administration study found no medical benefit to hydroxychloroquine when it comes to coronavirus patients, and that it could actually be harming patients who take it. Joining me now is CNN Chief Medical Correspondent Dr. Sanjay Gupta. Sanjay, you know, this is crappy news. We all want something to work. Take us through this study.
Right. Yeah, no doubt. We're all looking for some sort of therapy, and hydroxychloroquine is the one that's been getting a lot of attention. This is a study of some 368 patients. Still a small study, Jake. We're going to get larger data studies, so we have to take all of these studies with a little bit of a grain of salt. This one was not peer-reviewed. It was not randomized, meaning patients weren't put in one group versus the other, but in some random fashion. But nevertheless, exactly what you said, Jake, the patients who in this study got hydroxychloroquine and azithromycin, that's the Z-Pak, the antibiotic, this study, they did worse. They had close to a 22% death rate as compared to the patients who didn't get those medications, who had about an 11.4% death rate. So it doesn't look very promising. You know, this is another study among a drumbeat of studies now. Again, all of them pretty small. We're still waiting for the larger studies. But if you look at France, you look at Brazil, you look at Sweden, you're hearing similar things. In France, they said they found a dose that was too toxic. It was actually causing heart arrhythmias. In Sweden, they gave guidance to all the nation's hospitals to stop administering this medication outside of a clinical trial. So, you know, I think you framed it perfectly. We all want something that works. There's obviously been a lot of enthusiasm around this particular one, but so far, the results have not been that impressive at all, Jake.